Welcome to Fitness in Motion Canine Stretching Exercises. I'm Dr. Ava Frick. I've been doing physical rehabilitation since 1997, and it's enjoyable to see how the animals respond. And when we apply the right things, we can maintain their health well into their senior years. First, I want to explain to you some things to do to really be ready. There's a certain point in time where getting ready is a priority. One of the things that we want to do for animals before we stretch them out is actually to heat the tissue. And there are a lot of different ways that you can apply that heat. One of the ways is to have a flax pillow. We like moist heat. Moist heat will actually penetrate into the muscles and tissue better. So you can use flax pillows. There are different sizes. So here's a smaller one and a larger one. These can be put in your microwave. They're heated up. On a large one, we'll normally heat it for about a minute to a minute and a half one direction, and then you'll flip it the other side and heat it a little bit longer. We want it to be warm, but not too hot. The other thing that I like to do, especially for these items that are going either in your microwave or when you use them for cooling, they go in your freezer, is to actually put it in a pillowcase. So we have different kinds of pillowcases here that we will slide the flax pillows into. This way you can keep the fur out of your freezer and out of your microwave. Once the heat is, the packs are warmed up and you're going to apply the heat, normally you're going to do a warming of the tissue for about 8 to 10 minutes. And I know it can be confusing, like when do I apply heat and when do I apply cold? So here's how I learned to remind myself is that winter always comes before summer. So you're going to apply cold compresses first, anytime there's an injury, and you're going to apply warm compresses second. So we want to use the cold to take out the inflammation. We want to use the cold to reduce the circulation to an area. So if there's bleeding or swelling and we use cold, it will actually suppress that effect, and that's what we want. In a chronic situation or after the first 3 days of an injury is the time to apply the warm compresses. This will bring the circulation back into the tissue. It will help with that circulation and pick up the trash that's been deposited because of the injury. It will move that out of the area so the body can actually dump it. And it also helps then bring in the good nutrients. So any medications or supplements or vitamins, minerals, things like that that you're using to help in the healing process will get to that site much more effectively. Your options for cold. Certainly you can take the same flax pillows and put those in the freezer and have them cool that way. There are the kind of cold gel packs that you can purchase, and if you do that, make sure that it is the kind that are soft, that they don't get totally frozen hard, because that's not as comfortable on the tissue. There's another option. You can use styrofoam cups and fill those with water, and you can have those in your freezer. It's always better when you're doing an application of cold if you can apply the cold but also massage the tissue. So this is where the ice cups come in handy. And this is even a thing for people who are on the circuit and going to shows. You can have something like this handy that you could put in the freezer of your motor home. Another option that you can make at home is taking alcohol. So it's regular rubbing alcohol. It would be 1/4 of that. You want a freezer Ziploc bag, so 1/4 of alcohol, and the rest you would fill with water. And you can make your own cold compresses. This will not, it's kind of like a slushie. It will not become totally hard. Then when you go to apply this onto their body, you actually want to wrap it in a towel. We don't want to put anything cold directly on the body that's going to be sitting there for a while. So you would take the cold pack and then wrap it in a towel and then lie that on the area that you're trying to chill. Thermacare is another way. There's quite a few different products like this, but this is another way to apply heat. These are air-activated heat wraps. They're used once only, but this is something handy that if you're traveling, that you can have. You just take it out of the wrapper and then open it up, and once you open it, then it will ignite and it will help keep that tissue warm for about 8 to 10 hours. So something that you can apply before you're doing your exercises, but especially in a situation where you have a body that has a lot of arthritis and you're wanting to warm that tissue over a longer period of time. So those are options on applications for warm and cold. The next thing we want to look at are the devices that we recommend for being prepared also for these patients that need some extra support. Oftentimes in practice, a client will come in and they too are becoming exhausted from having to lift and tote a dog that weighs quite a little bit of pounds. The owner having to bend over and pick them up and help them up and down the stairs can often be a detriment to the longevity of that pet, because if you wear out, then it's hard to keep going for them. So it's really important to have the right materials, the right clothes, the right articles to help. We want a support harness. And so this one's called Webmaster. This is the company that we have found, and others who do rehab as well, that does a really good job in supporting the body. And it allows the owner to be able to pick them up and help them move along. So we have a model here today. Her name's Sarah, and she actually has the Webmaster harness on. So we're going to show you what they look like when they're actually on the body and how you can use that to help you navigate the dog. Sarah is modeling a Webmaster harness. They're designed to give them support across the front, support along the back, and also through the belly. So on a dog that you're walking or trying to help upstairs, it's really easy to just pick up at the handle, and that takes weight off of their legs and their spine. It's amazing when you put them on a scale, and I have a client just pick up a little bit. What seems like a little bit of weight to them really lowers the weight that their legs are having to carry. So this is super important to have the right devices to make it easier for you and for your dog. Another thing that we use in a situation where the dog is having troubles with their rear legs are a couple style of rear leg apparatuses. There's one that's called a bottoms up, and this is designed by a company that actually has pads on this, and it's set up to fit over their rear legs. You want to make sure it's up inside of the groin area. Then when you walk them, they can be walked holding onto the lead rope as well as this, or it can also be clipped into the harness, so it makes it a little bit easier. Sometimes you can even navigate them this way. This takes weight off of the rear legs. So if you have one that has bad knees or bad hips, you can utilize this. Now this one works great for large-bodied dogs, but as you can see by the width of the harness for the bottoms up, it's too wide to use for a small dog. So we actually make what we call giddy up, and this is simple for you to make at home. You just take some of that nylon rope that they used to make horse halters out of, make a loop on either end, and then I take some of the little electrical ties. We zip tie it here. You want to burn the end so that you don't have to worry about it fraying. And these fit on just the same. So this works for smaller dogs. That way when you're applying this and helping them walk, the wider the band in the groin area, it tends to make their legs go out. So by having something more narrow for the smaller dogs, then it doesn't do that to them. This is very inexpensive. You can make it home. You can make the rope as long as you need to for your height. So obviously if you are 6'2" and you have a dachshund that has leg problems, well, you're going to want a much longer lead than what you do for a German Shepherd and you're 5'5". So these are things that you can make at home to get you ready for what you are going to do in preparation and support for your dogs. Another part of preparation is balls. All size of balls for all size of dogs. Many of these you can purchase at any of your local hometown stores, Walmart or Target or those kinds of places. This is actually a human ball that you find for doing Pilates and exercises like that. You can inflate or deflate the balls to fit the size of your dog. I know that spring and summer are usually the easier times to buy balls inexpensively because it's playtime. So if you're thinking about going to set up an exercise program, then you may want to capitalize on that time of year. So medium-sized, larger balls, and smaller balls of all different sizes depending on what the size of your dog is. And we use these balls under their abdomen. We're going to place the balls under their tummy and sometimes under their chest or under their front legs to give them support. This is the closest thing you can do to mimicking having a dog in water. The air inside the ball takes the weight off. It gives them buoyancy, so it allows the dog to stand. It allows you to do some rocking and shifting exercises. It allows you to do some things by holding up one leg at a time or even working on their backs without them having to maintain all of that weight on their legs. So if we have one that has arthritis or a dog that has neurologic problems to where their positioning and their balance is very poor, these balls give them the opportunity to actually get in that standing position. And that's very, very crucial to us building muscle tone. If they're always sitting, they're not going to build muscle tone. And oftentimes even for you doing exercises, it's more difficult for you because they keep wanting to sit. You put some of these balls under their tummy and under their chest, depending on the length of their body and the depth of their chest, and you will find out how much easier it is for them and how much more enjoyable it is for you. So I'm going to get a couple of our models here and actually show you what it looks like when you have some dogs on balls. Sarah is modeling a medium-sized ball. Sarah's about a 50-pound dog, and this would be the medium size. So that'll give you kind of a relative factor to judge. If you have a dog that's potentially 100 pounds, then they're going to want the larger size ball. It also depends on how deep their chest is too. So you can see this ball fits right behind the chest. It's in the loin area, the lumbar area of the body. And this allows then to take some weight off of her so that if you are doing rocking exercises, and we're going to go through those, also if you're doing anything on the back. So from my perspective of doing animal chiropractic, this is one of my most used tools, is being able to put the dog on the ball. They can't sit down when the ball's there. So it allows them pressure off of their legs, especially if they're old and kind of rickety, and it allows me to be able to do my motion palpation and the adjustments. So this is what it looks like with the medium. Now we're going to look at a longer body and what you sometimes have to do, which is 2 balls for those size dogs. Cheerio, being a longer bodied dog, would require 2 balls if she was very, very weak. So she's a Nerf girl. We got a Nerf football, and I will place that under the chest and the front legs, and then a Nerf softball, a round one, more foamy, under the back legs. And it doesn't have to be the Nerf style balls, but it gives you a relative idea for what to go shopping for. So sometimes in these longer bodies, and again, if they have front end problems, if they have arthritic elbows, sore shoulders, that's going to take some pressure off of them there so that you can actually do your exercises. So you can be integrative and inventive. Round balls, they come in smaller sizes, even little tiny footballs. So we're looking at the smaller dachshunds or maybe a Chihuahua. Sometimes these are going to be the optimal size for those dogs. So there's all kinds of balls. You can shop in the kids department, in the game department, and make your life and their success easier and better. Another preparatory support and item that you can apply is massage. And a lot of people are interested in, okay, how can I do the massage? We know that petting and touching is very, very beneficial. So just a few little pointers on massage. You want to focus on the areas where there are muscle groups or any place where you might feel some tension. A dog that has rear end problems is going to be shifting a lot of weight to their front end. So they typically get very tense and sore across the shoulder blades. Another area that becomes sore and tense is in the lumbar along either side of the back. And certainly if you have a dog that has knee problems, then their quadricep muscles are going to tend to get tight. And so focusing on those leg muscles will also be beneficial. If you have problems with your hands and you're arthritic or you have weak fingers, you can always use a little ball to help. It could be a tennis ball or some kind of a little rubber ball, and you can use this to help with your hands. So the first part of massage is going to be circles. So you can either do the circles with your hand, that way, or this is one of the areas where you can take the ball and you can use the ball in circles. You can roll it this way, or you can just take the palm of your hand and roll the ball. The ball is really good for individuals who have weak fingers, or if you have arthritis and if that aggravates them, then you can use the ball. So with the ball, you can go in circular motion like this. You certainly could use the ball in a cupped position, moving around the muscles too. So first we do circles, and focusing on those areas of the body where you've determined there's either a tenseness in the muscles or soreness, or if you know there's any trigger points that are in that area, then you want to focus on that. And usually you can start with this phase, again depending on the size of the body and how much area, you'd be looking at maybe 3 to 5 minutes. Next is going to be kneading. So kneading, kind of like what a kitten and a cat does. You're going to be doing little pushing motions through that area. It's like if you were kneading bread. The third phase then is linear strokes. So with this, what our goal is to actually move out of that tissue any toxins, anything that you've loosened up. We've improved the circulation with the kneading. You've brought circulation to the area. You've reduced the tension in the tissue. Now what we want to do with linear motion is actually pushing that out of that area. We want the lymphatic system and the veins to pick that up, pick up those toxins, pick up the trash that's been stored in that area, and move it out of the body. And we can encourage that by doing linear strokes. You can also do those linear strokes down the legs. The same kind of thing. You would do your circles, then knead, and then linear strokes. You can move it all the way down and out through the feet. So we can make massage simple and an effective approach to starting preparation for the muscles for the stretches that you will be doing. Leg stretches are an important part of being able to increase circulation to the joints. This is also a really good exercise to do before any kind of an athletic event. So the exercises that we're talking about is not just for an animal, a dog that has a problem, but it's also for those that are athletic and you want to maintain that good health. We want to keep circulation going to the joints. We want to prevent muscle tie-up or sprains or strains. So I'm going to start with the rear leg. Wendy, who's our model, actually does have some arthritic hips and knees. But a short-haired dog is very good for demos. So when we start with the leg stretches, there's a few things that you want to make sure that you maintain. One is what we call neutral position. Neutral is where the leg would be if you were walking, if the dog was walking, which means that it's not adducted, so you're not lowering it towards the body. It's not abducted, which is rising it too high. It's kept right in that plane of where they walk. So this is neutral position, and this is where we start. We also want to make sure that you keep the toes pointed forwards, no rotation. We don't want to rotate. What we're going to be doing here is signaling this body what's correct and what's right. So if we start rotating the leg as we do the exercises, we're giving it wrong information. So neutral position, the toes pointed forward, no rotation. We actually have a couple tools, which is pretty cool. We can use our hands, perfect fit for the stifle, which is their knee, and also a perfect fit for the hock. The dog's hock and knee, and this is the same with the cats, although a smaller version, fits right into our palms. And we're going to use those as our leverage points. All I'm doing is just pressure on the stifle and the hock, and the leg extends. So in the neutral position, you start relaxed. I'm going to extend the leg, and now I'm going to add just a little bit of stretch. So you'll take your hand, and as you see, I'm supporting her leg in the front and in behind. She's not out there by herself. When you do this, it makes them much more comfortable. They know that you're there with them, and it gives that added support and comfort level. So supporting the leg, I've done the extension. Now I'm going to grasp at the hock, and I'm just going to give it a little bit of a gentle pull. And as I do that pull, I'm going to count 1001, 1002, 1003. Now I'm going to let her relax again. I'm going to move the leg forward. Again, keeping support in front and behind of the leg. I move it forward just to the point where I can start to feel tension in the hamstrings. I can feel it along my arm because it's here. I can also tell that the motion is getting a little bit tighter. So that's our tight point. I'm going to extend the leg. Notice that we're still maintaining this neutral plane and her foot is pointed forward, no rotation. Now I'm going to grasp and stretch. 1001, 1002, 1003. Relax the leg. Now we're going to go in reverse. So the prior move was helping to extend the hamstrings. Now we're going to stretch the quadriceps. So if we have these that are tight, you're going to realize that it won't go quite as far. Neutral plane, I'm going to bring it back. It starts to get tight. Now I'm going to extend the leg, close, and stretch. 1001, 1002, 1003. The better condition the leg is in, the better condition the hip is in, the further you can go. But you don't want to go too far at first. Just take it in increments. You want this to be comfortable. If you go too far and overextend, you could actually cause some aggravation, which could elicit some soreness. So we don't want to do that. So go to the point where you can feel it tight, and then you're going to extend the leg and stretch. We've gone through 3 steps. Now we have number 4. Number 4's goal is to help with circulation at the hip socket. The hip is a ball and socket joint, and so there's a lot of circulatory impairments. We don't get a lot of nutrients into the joint. And when we have bodies that are arthritic, that adds to that compensation. So we want to help get circulation into the hip, compress the leg. We're going to open up that joint. And again, depending on how healthy the hip is initially, you may not go as far. So this is pretty good for Wendy. This segment right now, what we're going to do next is kind of like washing a window. You want to keep this whole leg, as it's compressed, in the same plane. We don't want to be rocking it like that because that's going to add torque to some of these joints. So we want to maintain it flat, kind of like washing a window. I'm going to take this entire leg and I'm going to make little circles. So we start very small at first, and your goal will be, as the condition improves, then you'll make bigger and bigger circles. So we do 5 one direction, and now I'm going to do 5 the other way. 1, 2, 3, 4, 5. As this gets easier, and as you've done these exercise series, you'll be able to make bigger and bigger circles. So they're small circles initially. So that's the 4 steps. Now you would repeat that 2 more times. So it's a series of 3 within this whole exercise. So you do the straight, the forward, the reverse, the hip 3 times. 1, 2, straight, forward, reverse, and open. Going slowly, holding at each of your points, doing your stretches and counting up to 1003. So you're getting your 3 seconds, and then on the open the hip is 5 circles. The things that you would want to do, we talked about warm compresses. You can do that prior to get all this tissue warmed up. It's going to help with the stretching. So you do a warm compress for 8 to 10 minutes. At the end of the exercise, especially in ones that do have arthritis, you can do it then, or at the end of your day is a good time to apply a cold compress. So for the cold compress, we do not want to exceed 20 minutes. So somewhere between that 10 to 15 minute mark for the cold compress at the end of the stretch exercise is good. And that'll chill out any inflammation that might have set off from you doing the exercises. All right, so there's a similar one to this that we do on the front. If you have a dog that has problems, or that you're stretching for exercise and you want to do the whole body, you can do the left and the right, and then you would flip them over and then do the other side, front and rear. So you can do front and rear on one side and turn. If we're only doing the rear, so you would do, as this would be the left, and then we would turn Wendy over and do her right side. So I think you pretty well can get the idea of that. It would just be reversing your hands, cupping and holding like we did here, only on the opposite side. So after this, we will move to the front leg and show you how we use the elbow and the carpus and the shoulder to do this same exercise on the front. This is the front leg stretch exercise series. We want to start with the leg in neutral position. Neutral is where it's in the same plane as it would be if the body was walking or standing. That means it's not adducted, it's not closed in close to the body. It's not abducted, pulled away. We want it in the neutral plane. The other item that's really important is that the paw is facing forward. We don't want to create any rotation, because adding rotation would change the parameters of every joint. And so these exercises that we're doing is trying to improve the body's posture. If we start changing angles of the joints, that's going to interfere with that posture. So we want to create a better balance in the body. We use the palms of our hands as our fulcrums. So it fits right at the elbow. And you can use it at the carpus also. So their joints fit right in the palms of our hands. As you'll notice too, I'm also supporting her leg. So I've got my arm running along the front and along the back of her leg. And this makes them feel more comfortable about the exercise. You're not leaving them out there dangling. All right, so where we start, with the leg in neutral position, we're going to straighten the leg, then gently grasp down at the carpus, and then we're going to pull, and you count 1001, 1002, 1003. Allow the leg to relax. Now I'm going to gently guide it forward from the elbow. Extend the leg. Gently pull. 1001, 1002, 1003. We let the leg relax again. Bring it backwards. Now this is going to help stretch out the biceps and the muscles that are extending up into the neck and the cranial radialis muscles. So we're going to work at extending these and stretching the muscles on the front aspect of the leg. So extend, close, stretch, 1001, 1002, 1003. The next then is to open up the joint. And when we do this, we're helping to increase the circulation in the glenohumeral, the shoulder joint. It's a ball and socket joint like the hip is. So we're going to close. This is done all in one plane. We don't want to add any angulation or rotation to that. It's kind of like washing a window. It's all done in one plane. We're going to open it up and we're going to make little circles initially. As you do this exercise, you'll be able to add larger circles. We do 5 one way and then 5 the other way. 1, 2. Also, when you do this, it's a fairly slow motion. You don't want to get going fast. You want to do it very slow, because that's going to help benefit the joint more than if you were going fast. Okay, so that's 1 repetition. You will do a total of 3 repetitions. So you would repeat again the extension, 3 seconds, forward, 3 seconds, reverse, 3 seconds, compress and open, and 5 circles each direction. You do those for a total of 3 times, which makes up 1 set. So there's 3 repetitions that equal 1 set. And over time, what you'll find is as you do this, that you begin to be able to extend forward more further, reverse further, and you'll be able to make larger circles as you do your exercises. So that's the front leg stretch series from a recumbent position with them lying down. These are good exercises to do twice a week, 3 times a week. You might do it daily if your dog had had surgery. You can also use them before you have an agility or an activity event, fly ball, Schitzen, whatever you're doing to help with the legs. You can also use them in the evenings after you've exercised. Again, warm compresses for 8 to 10 minutes before you're going to stretch is optimal. And at the end of the stretching or at the end of the day to apply the cold compress, and that would be anywhere from 10 to maybe 15 minutes. You definitely do not want to go past 20 minutes when you do cold compresses. This is the front standing leg stretch series. It's similar to what we do when they're lying down, but in a standing position. So we want to take the leg that you're going to stretch, support the leg. I've got my right hand at her elbow, and I'm supporting the front of the leg with my left hand. I'm going to extend the leg. You'll bring it just to the point where you feel it get a little tight. Again, you want to keep the paw faced upwards. We don't want to do any rotation, so we're watching out for the angles and the rotation, as well as keeping the leg in the walking plane. Notice when I brought it up, I just came up straight. I didn't bring the leg out. So for this point, we're just moving forward and straight. Thank you, Ella. Another thing too that I didn't mention when we started is that it's good when you do all of these exercises to make sure that you start them in a squared position. So starting this exercise with all 4 legs in their quadrants, you want to have them squared up. That's going to give her the better balance. Then what we do is extend the leg. So I'm going to support this leg at the elbow with my right hand and down at the carpus, which is her wrist, with my left hand. So I'll bring the leg out forward. I've got the paw pointed up. I'm going to bring her out to a stretch. Then the next is going to be to cross over the midline. So now I'm going to take this leg and bring it across the front. As we do that, we're stretching along the outside of the leg. Then I'm going to run the other direction. So now we're going to stretch across the pectorals and the inside of the leg. So I'm going to bring it out that way. Now I'm going to open the leg up. So again, we're helping to work the rotation in that glenohumeral, the shoulder joint. Now I'm going to extend the leg and bring it backwards. So we're going to take the leg and bring it back to the knee. So we've got the paw to the knee. So again, those steps are forward. We cross over. We come out, and as we come out, compress the leg and open. And then bring the leg back to the knee. So we got paw to knee. Each one of these would be done for a 3-second period. 3 seconds here. Stretch for 3 seconds, open, 3 seconds, back to the knee for 3 seconds. So each rep, that would be 1 rep, and you would do that 3 times, which would make a whole set. So 3 reps and 3 sets. And that is our standing front leg stretch series. Side bends and the cookie reach is used for several different reasons. This exercise can help with motion of the neck. It can also help with balance, so we're looking at shifting the body from one side to another. It can also help to stretch off the muscles of the back, to open up the lumbar, so we're getting more motion and movement in an area where there's been tension. We can also use the side bends to help with the rear end as well. So as we move and shift with the cookie treats, we can get weight back into one of the rear legs that maybe the dog hadn't been using because of having had surgery or arthritis or something else. So the side bends, cookie reaches, is a very good exercise for every part of the body as we're trying to regain posture and balance. So here's how this works. We want to start with them standing, and it's optimal as we're doing this if they do stay standing. If you have one that has a weak side and you're starting to do this, it's totally fine to position them against a wall because that will give them a point of support. As we turn the head, it's going to increase the weight to the opposite side of the body. So if Ella brings her head to the right, her weight is going to shift over to her left side. And vice versa. If her right side is supported against a wall and then she shifts to the left, you're going to add some weight to that right side, but she's not totally dependent on herself to keep her body upright. So you can use the wall as a little extra support when you have a dog who's weak and hasn't quite got the strength that they need to have on one side of the body or the other. All right, so as we do this, and this, you do want to have a dog that will bait for a treat to do this. There you go. See how she brings her head around? So as she does this, she's going to be stretching the opposite side while she's adding a little curvature to the side that she's turning to. So another situation would be if you had a body that had some scoliosis, we would want to try to train them to bring their head into the side that had the arc so that you can get that part of the body to move to the opposite side. So as she does her reach to the right, she is shifting her body weight to the left side. So it will increase weight to the rear. Normally we carry 60% in the front and 40% in the rear. So that's 30, 30, and 20, 20. Anytime there's been an injury or an accident, of course, the body's going to compensate and they'll be shifting to other compartments. So let's show you from the opposite side what it looks like when she shifts to her left. Come here, Ella. Come around. So now you can see how her body rolls to the right side. She's got herself in a nice squared position. Ella, let's turn this way. Come here. Come around. There we go. You can also change the results depending on if you have her focused in the same parallel, or you can also bring them down to increase the curve and change again the balance. So now when she brings her head around and down, she is adding more weight to the left front. So we got to think about the diagonals. The dog's being a quadruped, work on a diagonal. As she brings her body around, she is shifting more weight into this left front, but she's taking weight off of her right rear when I hold it down and out. I'll show you on the other side. Come around and down. So more weight now on her right front. If we keep it higher, Ella, then you're going to see how the weight goes to her left rear. So there's ways that you can do this exercise to improve the body weight distribution that is going into one quadrant or another. These exercises, when you start, you'll have them hold just for a few seconds, and as time goes on, then you'll be able to increase the amount of time, adding seconds on to how long they actually hold that position when they move. You can do these exercises once a day, or it's a simple thing. If you're going to give them treats, don't just give them the treat, make them work for it and have them practice this multiple times throughout the day. This exercise is called scapular rotation. Oftentimes with dogs that do a lot of jumping on the front end, or if they've had any irritation or surgery, or those that have a weak rear end that shift to the front, this area becomes very, very tense and tight. And we need to have mobility and looseness with the scapula. So the scapula is the big bone that sits on the rib cage. The scapula itself does not have a joint per se connecting it to the body wall. It's just connected by muscles. And so this area is very much affected by tension in the muscle groups. So we want this to be able to be very loose. So I have right now my hands kind of in a circumference area around the scapula, so you can get an idea on Sarah where her scapula blade is. So this is the area that we want to loosen. So with your hands on either side, you can start just by making rotations of that scapula along the body wall. You may have wanted to, prior to this, done some muscle massage in all of the muscle groups leading into this area. So you could have done muscle massage all around the rib cage and the front leg. So we're just loosening up. So we're going to go 5 times one direction and then reverse, and we will go 5 times the other direction. You can also hold the leg together and compress it from this direction. Now I can grasp a little bit more under the shoulder joint. So this is a glenohumeral joint. It's where the humerus comes in and connects to the scapula at this point. So I can hold there and actually do a little bit of a lift. So we're pulling it away from all of that tension in those muscle groups that have held the scapula down to the body. So I'm lifting. We can also lift from the back side. So now with my thumb a little bit under the shoulder blade and my hand supporting at the glenohumeral joint, we are lifting it in a little bit different direction. This becomes very, very relaxing for the dog. To get the tension out of that tissue is very, very beneficial. It will help then eventually to reduce those trigger points, and they'll be able to move more freely. So again, for those ones who are supporting a lot of weight in the front because of the arthritic rear end, a lot of tension here, this is a beneficial exercise. Also for ones who have had any kind of surgical procedure in this area where again they have held their body together. It may also be that you have an injury. So with this being Sarah's right leg, she could have an injury on the left, which may have caused her to stand more on the right. So it has gotten tense because it's been a supporting part of her function. And so relaxing this will help that too. So those are the times that you would want to do some of this scapular rotation exercise. This is the front leg. We're going to do paw pressure compression exercise. In situations where an animal has not been using their front end, they'll start to get flexor contraction, just like a person. If you're paralyzed or you have reduced nerve function to an extremity, you start to move inward. And that's what will happen with the animal. So if the dog has had neurological impairment, or say if they had surgery and they haven't been placing that paw down, they will be unable to, because the flexor tendons, the one on the back side of the leg, they won't be able to open up. So they get shorter and shorter, which pulls the leg in. So what we want to do in this exercise is to mimic that foot actually having weight going through it, pushing the paw down. We want to exercise these flexor tendons to get them to be able to extend so that the dog can put their paw all the way down on the ground. So there's several different ways we can do this. One is just to take the paw and with your palm of your hand apply some pressure. So I'm supporting the leg. You can either do it at the elbow or down by the carpus, and just pushing that paw outward. And you do little pump actions. You can do those up to like 20 times with each session, and that's going to help give information to the foot. But the foot's not in that exercise, it's not in a standing position. So we're getting pressure through it and extending the flexor tendons, but it's not the same as if they're standing on the ground. That's going to be a little different signal to the body's neurological mechanisms. So another way to do this is with the foot on the ground is actually to come up a little bit higher and through the elbow give pumps. So you can see that the paw is actually moving with each pump. Now, a situation where you would want to do this in a different location would be if they had a lot of elbow arthritis. To actually apply pressure through the elbow would not be that comfortable for them. So you might have to move below the elbow, between the elbow and the carpus, and then do your pumping action that way. So you can do this with the dog sitting. You can also do this, oftentimes if it's weak on one side, it may also be weak on the other. So you can do both legs simultaneous. You can also get into a little bit of a motion like if they were walking. So you're alternating left and right legs as you do this. And you can even vary the alteration. So you may pump twice on the right, one on the left, twice on the right, one on the left, and then maybe you'll choose to do 3 on the left and 1 on the right. So you can alternate those signals. But all of this is helping to extend those flexor tendons. Again, if they've been drawing their paw along the ground and wearing the nails down, that's a situation where they're not really extending the paw well. And so we want to get that opened up by reducing the draw on those flexor tendons. We want to extend and open and lengthen those flexor tendons. This can also be done with the dog in a standing position, but basically it would be the same kind of action if the dog is up. And if you wanted to do it from a standing, you can certainly put a ball under their tummy if they can't stand, and then do that same alternating motion, getting that paw to extend so that we are stretching and lengthening those flexor tendons. Rocking exercises can be used for all types of situations and all kinds of indications. We will use rocking exercises for increasing weight bearing on a part of the body, so a limb or a part of the back. We'll also use rocking exercises in situations where we're trying to improve balance, as well as one that's had a neurologic problem like a disc in the back where they've not been using part of their body and we're trying to regain that sense of, again, balance, but also function. In a dog that's having problems standing up, this is another time where you can use a ball. So putting a ball under their abdomen gives them a little bit more buoyancy, a little bit of support without really guiding them on what to do. You can also use this for all types of situations without having a ball. It just depends on what's more comfortable for the dog. So when you do rocking, it's good to have them squared up. So we want to have their front legs under them, as well as their back legs. If you're doing this with one leg forward and not really being squared up, so a squared up stance is as you see Sarah now, where she has all 4 legs under her. Okay, good. Good, there we go. All right, so rocking is gentle pushing. We can push from front to back, gently that way. We can also push from side to side. So we could push from side to side in the front, just back and forth like this. Now notice when she moves her head, and this is good for you to see, when you move your head, when she moves her head to the right, it actually increases the weight bearing on the left rear. And if she moves her head to the left, it's going to shift her weight to the right rear. So when we're working on trying to get an even balance, it is important for them to keep their head central, because that's going to help motion left to right in an even. So what we want is 60% of the weight in the front and 40% in the rear. So that should be 30% of their weight on the left front, 30 on the right front, 20 on the left rear, and 20 on the right rear. Any motion to the front end, of course, is going to change that shifting. Now it's good in doing this exercise because we're going to increase the ability of the dog to receive that weight on one leg and be able to push back to the other. So where you want to start is in the middle, doing everything that direction, even. So we can go forwards and backwards. Then we can add the diagonal. So she's turned to this side. So we can add a push from the right front to the left rear. And I'm doing that diagonal. Or we could switch and do from the right front to the left front, to the right rear. So we can go from left front to right rear. We can go from right front to left rear. We can go straight forward to reverse in the rear, so front to rear. And we can go side to side. So this is a rocking exercise. You can do it for one who can totally support their weight, do it without a ball. But if you have one that has any bit of ataxia where their balance is not so good, or if they are older or have weak legs and maybe a poor posture, we can add that ball to give them that extra support. This is one of the type of exercises that you can start off doing a little. You can do it multiple times throughout the day. When the dog comes up and stands next to you, you can just do a few little rocking motions. And then as time goes on, you can add more. Hopefully they get to the point where as their balance improves that you're not required to need to utilize this exercise as much, and you'll move on into some of the more advanced exercises. But this is a good place to start. After surgery, getting weight back on a foot, getting them to use a leg in combination with some of the other exercises that you're learning. We do high fives to help increase the use of their front legs. This is actually a front leg strengthening exercise. So Sarah, can you give me 5? Good girl. All right, you can use this to hold it. You'll start off just bringing the leg out a little bit and holding it for a shorter period of time. As they get better, you'll be able to hold it up higher and increase the stretch. Give me your other leg. Very good. All right, that's a good high five. Left, very good. Give me your right. Right, very good. Adding the next step to this would be asking the dog to do it from a standing position. Again, sitting is going to be a little bit easier because they're only dealing with the front end. Once they're standing, when they pick up a leg, it is again going to shift their body a little bit differently, and it's going to increase the amount of balance and support they have to have on the opposite front leg. So it's one of those exercises that you're going to work in gradients. You start with in a sit, 5, very good girl, right, very good girl. And eventually then you can increase them to doing it from a standing position and holding them longer. Side passing will help improve the body's proprioception, them knowing where their feet are. It will also help improve their body balance and coordination. So this is, as it says, side pass. We want to graduate to where they're actually kind of crossing their legs over as you do this, just like a horse would. In initiating this exercise, you want to stand close to the dog. We're going to encourage with treats and also just give them a little bit of nudge on the side that's close to you. All right, so Ella, we're going to do a side pass. So nudge. Very good. Try again. It's going to start off with, we will start off with just asking for one step at a time. Very good. And then as time goes on, they'll be able to get faster. Side pass. Good girl, Ella. Good girl. Now we'll go back the other direction. So ideally, they're doing this with their rear legs at the same time. Side, pass. Okay, let's get your legs over. Side pass. Good girl. Here, Ella, this way. Side pass. Good girl. One more. You do side pass. Good girl. Alrighty. So increasing that motion of one leg stepping next to the other, crossing over the opposite leg, gradually being able to take more steps in a sequence. This will help improve their left to right balance and their proprioception. Leg lifts are done with the intention of being able to shift the body weight onto a different leg. This can be done with a ball, or it certainly can be done without a ball. It just depends on how good the dog can stand, or if they prefer to sit all the time. A dog that's been trained to sit, sometimes you pick up a front leg and then there they go, they're down. So what we want to do is encourage motion to another leg. So this is one of the exercises that we'll do in a situation where a dog has had surgery and you're trying to encourage them to use the opposite leg more. So in this situation on the front, if Cheerio had had surgery on her left front, I would pick up her right front leg, and it causes her then to put more weight into her left front. This is one of the ways that we can encourage them to start using that leg again. So if she'd had surgery or a problem in her right front and hadn't been an injury, hadn't been using it as much, I could pick up the left, and then it's going to shift her weight over to the right. Remember again that our normal proportions is 30% on each front leg and 20% on each rear leg. So when there's injuries, that balance is going to have changed, and we want to try to get that body proportion and their posture and balance back again. We can do the same thing on the rear. So by picking up the right rear, it's going to shift weight to the left rear. The dogs being a quadruped, anytime you work with their gait, you will notice that they also work on the diagonal. So also picking up this right rear leg not only shifts to the left rear, but you're also running the likelihood of getting more weight onto the right front, or the left front, sorry. The same would be with picking up her right front. You're going to then get more weight distributed into her left rear and also her left front. So it works on the diagonal and what is called the contralateral side. So we're shifting all the way to that side of the body. It's really important when you go to do these that you do make sure that their posture is already as good as it can be. We don't want to encourage a distortion to become worse. So if you had some curvature to one side and you were pushing them that side, it's going to be more uncomfortable. So lifting the legs, we'll shift the weight. You can hold the leg up for a few seconds and put it back down. You will observe as you're doing this, how is their balance? How are they doing? Sometimes you may want to add some support. You could even put them against a wall and use that wall as a body support when you're getting started. You have to be able to read your dog, read the patient, and know how much of this can they tolerate, how much support do they need. We want it to be easy to a degree, but we also want to give them a challenge. So as time goes, they will find that it's easier and more comfortable for them to do each step. You'll be able to not only see that they're putting weight in each foot better, they're starting to use the leg that they weren't better, but also just that their general motion when they're walking and trotting will also improve. Another exercise pattern that we like to do on dogs to improve their balance and coordination is rocking. While Gus is up on the balls, we can actually take and rock from left to right on the balls. We can also rock from forward to rear. We can also do the diagonals. So left front to right rear, or right front to left rear. And you can do these in a sequence pattern along with the other exercises I've been showing you. There are also what are called rocking exercises that will just isolate one part of the body. You can certainly purchase rocker boards. These are the kind that physical therapists use that the dog can stand on and rock. But you can make one at home. It doesn't have to be expensive. This is a 2x4 that's been painted, and it has a strip of walking tape. These are the kind of things that would be on stairs or someplace where you want to have a gripping surface. So I've put this on here to give them a little bit more support, and a little piece of PVC pipe. Now Gus still has some inadequacies in his balance, so this can be a challenge for him. First I'm going to get him up on the board. Thank you, Gus. All right, so he can feel that. Again, you want to do this with them balanced, their legs underneath them in a good standing position. Now I'm going to put a little bit of this small PVC pipe, so it's going to give us an angle, and it's going to create what would be like a seesaw. So this is in the middle between the two legs. We have somebody holding his front in here just to support him. He's seeing what's going on. Now I'm going to rock back and forth. Back, forth. Going from left to right. And he's having to sense that the ground underneath him is moving. I'm going to reposition him a little bit. Back up on your feet. And these are the challenges of working with a paralyzed patient, is getting them to be able to appreciate motion while they're standing and finding their balance point. As they get better, you can increase the size of the piece of PVC pipe and also increase the amount of times that you rock and the speed that you rock. So again, another exercise that you can use, something that you can do that's not expensive when you make it at home. So that's rocking and rocker board exercises. The next thing I want to show you is also something that's very simple. This is a scrunchie. These are actually things that women will put on their ponytails. You can buy these in individuals or in packets. You can use this to put over a leg to increase them to shift to the opposite side. So you know, if you put a boot on a dog or a cat's foot, they pick it up a lot. As they're picking it up, it's causing them to move to the other leg and put weight on the opposite side. We also can use it for a leg that doesn't have a good sensation. So you put the scrunchie on above the hock, and that will help them feel that their leg is there. And so then they will pick that leg up better. So you can use this in two ways. One is to improve the awareness of one leg, but also you will be improving the weight distribution to the opposite side. When you put these on, you only want to leave them on for a short period of time, maybe 20 minutes or so at a time. It's not something that you put on and leave there all day long. The reason for that is this. Just like in your home, if you put a new picture on the wall, every time when you walk in the house for a while, you look at that and you say, oh, what a beautiful picture that is. Eventually, if you think about it, you walk in and out of your house and you don't really notice that picture anymore unless you decide that you're going to focus on it. And that's how this is. If you leave it on them all the time, it won't have the same effect as if you take it off and then reapply it. So it's a simple thing to do. It's a scrunchie, and you put that on there above their hock on the leg. You can also do it on the front. You would put it above the carpus and do the same kind of thing. It will cause them to shift their body differently. It'll also increase the awareness of that particular leg. The standing rear leg stretches is for improving flexibility for the rear legs. So the standing rear leg stretch series is going to be a set of 4, similar to what we do when they're lying on their side, but now they're upright. So sometimes you don't necessarily need the dog to lie down. It may be a situation where you're getting ready to go in for agility and you want to just do a little bit of some stretching before they go to run, and you don't really want to go through the whole get them down on their side type of thing. So we can use this exercise. We're going to focus on Ella's right rear. So you do need to have them standing to do this. We're going to pick up the right rear leg, and first what we're going to do is to bring it forward. We want to bring the leg forward towards the elbow of the front. From there we are going to cross over. So when we come forward, we're actually stretching out the back side of the leg. When we cross over the midline, and it's better to do it low, closer to her. As time goes, you can work to get a stretch from higher, closer to the front leg. But initially, just a little bit off the ground, move the leg to the inside. Now this is going to help stretch and extend those muscles that run along the lateral or the outside part of the leg. So we've got her stretched to the middle. Again, first we picked up the leg, move it forward. Let her relax a little bit, come to the outside. Next we want to do the rear stretch. So you're going to take her from that position and bring it back as far as she can comfortably go. And then the last one is going to bring it out to the side, open up that joint, and you can do little circles to help with the hip. Now this one again will depend on how healthy that hip socket is. You may only get the leg out just a little ways to do this and make those circles. But anything is better than nothing. All of these exercises you're going to do with a timeline, bringing it forward. We usually start with holding about 3 seconds. Move to the inside for 3 seconds, back for 3 seconds, and then out for 3 seconds, and make your little circles. So you can do 3 one direction and 3 the other. And then as time goes on, you'll work at 2 points. One is being able to hold that direction longer, but also being able to go further. So moving forward, close to the front leg, with the goal of actually being able to take the foot and touch the elbow. Elevating the leg and bringing it across, with eventually the goal of being able to extend it further and cross the midline. The same way with the reverse, and then also for the lateral lift. Being able to eventually get the leg out further, doing that successfully and comfortably. You always want to be aware of what's the comfort zone of the dog that you're doing the exercise on. They will tell you, so it may be that you first start to feel the muscle get tight. The dog may shift on how they're standing. There may be a change in just their body posture. If they have a problem with the leg, so if there's arthritis or they've had surgery and maybe there's some areas that are tense and tight, as you go to move that, because they've had pain there, it will open up their awareness of this may hurt. So you want to go easy at first, do little, go slow. And with time, you can increase the reach and increase the amount of seconds, the timeline that you have for each of those exercises. It's all about doing the stretching, doing the exercising comfortably, but yet gaining in extension and range of motion and flexibility as you continue on through your series. The sit to stand exercise is one that's typical for using post-operatively. Cheerio has had TPL surgeries on both of her back legs, one when she was 2 and another when she's 3. She's now 11. And what we find is that a lot of these dogs will have troubles after surgery bringing the legs in. So our goal, again, is to get their posture right. We want those toes and those feet to be underneath them. Cheerio, stand. Good girl. So as they sit initially, and if it's for a bigger dog, sit. There you go, good girl. What you can do then is just gently with your hand or your foot, if it's a large sized dog and you're standing up, you can just take your foot and kind of move their foot in. Another way, stand, that you can do this initially, especially if they're wanting to shift off of a leg, is to actually do it along a wall. You can start with having them with one side against the wall, and usually we'll put their bad side there because it helps give them a little bit of a balance point and also a reference of pressure. So as they bring their body down along that wall, the bad leg won't be able to move out as far. That wall will help keep that leg underneath them. Very good, Cheerio. So over time, she's learned to get those legs back under her. Stand. So you do this repeatedly, sit, stand, throughout the day. This is an easy thing. You can learn to keep some treats with you, and instead of just walking up and petting the dog, you can actually ask them to do something. So ask them to sit and stand. Initially, they'll only be able to hold that sit for just a really short period of time. But as you go on and the weeks extend, you'll be able to get that sit longer and actually their legs under them. This is a really good tuck for the lower back and for the muscles of the rear end. We're working to hold that sit. And as time goes, it becomes easier and easier for them to do. Sit. Good girl. Especially if you got one that likes treats like Cheerio does. Front and up is a rear end strengthening exercise. You want to begin with elevating the front body, and obviously that's going to push some weight into the rear legs. So normally where we carry 60 and 40, if you've had a rear end problem, they've been shifting to the front. So now we're going to work at getting some more of that weight back into the rear legs. We want to start with just a little bit of an elevation. You could even use a board. something that's not too tall, and that will vary depending on the height of the dog. So for a dog that's less than 20 pounds, just using a 1-inch board would be a first step of increasing a little bit of weight to the rear end. For Sarah, we've used a step stool. You can do this in gradients. So as they get better about holding the weight at that height, then you can increase the height, still having them stand, but obviously now a lot more weight is going into the rear end. You want to do this with them being in a comfortable position for the rear legs, having a nice balance in both legs, that they're standing out far enough. Another way that you can do this is with using a ball. So you could also place a ball under the front legs, and you can change the height of the ball easily just by letting some air out or putting some air in. The front end up exercise for strengthening the rear end is something that you can do throughout your home. You can do it when you're out on a walk. Find a little place where the front end can be elevated a little bit higher than the rear end. And with time, this will help then to improve the balance and the weight bearing on the rear end, the left and right rear of the body. Dancing is fun for everyone, and you can use this as an exercise to help strengthen the back legs of your dog. Sarah loves to dance. Come on, Sarah. Ready to go? Come on, dance. Sarah, dance. Good girl. All right. When you start, you want to just take 1 or 2 steps forward, 1 or 2 steps backward, and allow the dog to have a break in between until they start to realize what it is you're asking. It's also important that you're doing this on a surface where they actually have some traction so that they're not slipping and sliding, because that's going to be really important to them. They're going to be focusing on, in their mind, is this safe? So everything you want to do is to make it as safe as possible for them so they will be relaxed and comfortable. Okay, Sarah, come on, let's dance. Good girl, there you go. Back. And you will gradually increase the amount of steps they take. Back. Good girl. You could even do this to music. So have a good time dancing. This is one that you would graduate to. It's not something that you would do initially, but it's a fun thing. You can start just a little bit off the ground and keep increasing it and eventually put it to a tune. There are many of our canine patients that end up having problems with their back, and they can develop lordosis, which is a sway back. This can come about because of a back injury, but it also could be because of weak abdominal muscles. So we need to work at strengthening both the abdominal muscles and the back muscles. So the way we can do this is to take the dog, have them stand on a ball. We can use this as one way to help elevate their spine. Now this will help encourage the lift, but it's not really going to do anything to make those back muscles stronger. So in order to encourage that, what you want to do is a little bit of a tummy rub. So you start up between the pectoral muscles at the front, and we're going to work our way all the way down to where the umbilicus is and past that into the back legs. And you work your way back up. And this is a fairly slow, but you can see on Cheerio how she's lifting her back. So you would go back and forth very slowly. We don't want to push this. Just a little bit of a lift several times. So 3 to 5 times. You could do 5 to 10 times, depending on what the condition is of the dog and how much they can tolerate. This particular exercise can also be done if they're lying down. So if you're wanting to help work the back muscles, but the dog is too weak to really stand while you're doing this, then they can lay on one side and you can rub the back, and then you can flip them over and rub their tummy again to help them engage the lumbar muscles and those along the spine all the way up through the shoulder blades. Alrighty, another exercise we can do for this is to encourage them with a ball under their tummy to actually reach down and out. So we'll get Cheerio some treats here. So with them on the ball, encouraging that lift, you're going to have them reach down and out. There we go. And that will help to create that lift and the elevation along the spine. So these are some simple things that you can do. It's very good for dogs that have problems standing on their own. You can use the ball, but those tummy lifts are easy for you to do throughout the day. Instead of just patting them on the head, you can rub them on the tummy. A kyphotic back, which is one where you have an arched spine. This can come about from dogs that have rear end weakness, where they tend to shift the rear legs underneath them. So if they had bad hips or bad knees, it will create an elevation there in the middle of the spine. So in these type of cases, we want to work to soften those muscles and get the tension out of them, which you can do by starting with moist heat. So applying moist heat along the back muscles and doing massage will help to loosen those muscles up. Then one of the exercises we can do to help with lowering that elevation once we get the motion there is to actually have the dog elevate their front end and reach up. So we'll show you doing that with Cheerio here. Get her standing. You can use, like, she's not very tall, so we're just going to use a 2-inch board. But if you have a taller dog, a longer legged dog, you can put them on a step. Or if you had like a little stair step, you can put their front feet up. A really tall dog, if you're out walking, you can even use a curb and just put the front feet up on a curb and their rear feet would be down. All right, so with the front feet up, and you want them to stand when you do this. And a treat always helps. Okay, so stand up. So what we want them to do then is to reach, and it'll also help too when you position them, if you can make sure that their rear legs are extended out a little bit behind them. You don't want them base narrow. You don't want their rear legs really close underneath them. So standing up on the front, then we're going to reach. There we go. There you go, reach up. And that will help over time to get that back with an arc, the elevation to actually begin to flatten and lower. Again, remember to have the rear legs positioned behind them a little bit as they stand on the piece of wood like we have here for Cheerio or some kind of a stair step. Another thing that's a really good one for these type of dogs, especially with the longer legged dogs, is to actually train them to bow. So you want to keep their rear end up and then encourage them to bring their front legs out, and their head will come down between the front legs. And that is another way then to help eliminate this kyphotic spine, try to get them to have that level. Because they're going to feel much better, they will be able to ambulate better, and it's just better posture for everything on their body. So give those a try if you have a dog with kyphosis. End-up ball balancing is an exercise that we can use to help with their balance, their general body balance. You can also use this as a way to help improve their balance and posture on the front end. You can start with a little bit of a smaller ball. It's better that it doesn't have all of its air in it. You want it to be a little bit soft. And just get the rear end up on the ball. Then you can rock this ball back and forth and work with their balance. You can also rock forwards and backwards. And with this, they're depending more on their front end in order for their support. You can graduate up to taller balls and higher balls, which the more angle you have in the rear, the more it's going to put weight on the front. You could even, if you decided you wanted to improve the rear end, would be to have less air in the ball, having the front end higher. And then it would accentuate the rear end a little bit more, putting weight into that part of the body. You can use the ball in circles. Sorry, you'll do it better facing forward. There you go. You can even do circles with the ball. You can work it from right and left. And it's another way that you can use tools to help regain function, balance, and the integrity of the spine. This is the preparation for doing tummy crunches. You can have the dog lying on their back between your front legs, so you can have them on you, or you could have them like if you were sitting on the floor with your legs open, you could have the dog in that position too. So we want to encourage the use of the ventrum, and initially we're going to have to help them. So we're going to work to bring the dog forwards, so you can do it either by bringing yourself forward, but you can also help by pushing them up and then letting them relax. So we know what tummy crunches are from the days when we had gym and had to do them ourselves. Roll up, there we go, roll back. Different sized bodies. Cheerio thinks this is the position we put her in to trim her toenails, so she's a little bit rigid. She's thinking, oh no, it's going to happen again. But you can use this for any body that even has a weak back. You're not going to have a strong back if you have weak abdominal muscles. So even as people, we need to strengthen our abdominal muscles in order to have a good back, and it's the same way with the dogs. You want to encourage the strength of the abdomen, which is also going to improve the strength of the back. Tummy crunches can be done in a series. You can start with just 1, 2, 3, start with a few, and gradually over time you can increase to up to 20 crunches at a time. There are exercises and tissue releases that we can do for the head and neck. If we think about a dog that's running through the yard, has a bone in their mouth or a toy in their mouth, they actually can affect the TMJ joint. So that is one of the points where we want to release some tension. The TMJ is on the side of the head, and it's right below what's called the zygomatic arch. That's the area where there's a wide point that comes out from the skull. And right in the middle of that is a little divot. You can feel it on yourself. You can also find it on your dog. Right below that is going to be where the tension occurs in the soft tissue that's supporting the muscles of that area. So you find that zygomatic arch. Just below that is the TMJ. If the TMJ is sore, that stands for temporal mandibular joint. If that area is tight, then it is going to be very sore. So it's going to be a very, very light massage. You're only going to put the amount of pressure that you would put on your eye if you were rubbing your eye. So usually what I'll do is use 1 or 2 fingers, very light pressure. And the side that's tight, you actually want to rotate counterclockwise. You want to like unwind the tension. So you're going to go counterclockwise, looking at her forwards, counterclockwise at that point. It's a very light massage. You can do this for usually somewhere between 1 to 3 minutes. And generally there'll be a point that comes along where their eyes will be more relaxed. You might even see them yawn. But you can just detect that there's tension out of that tissue. Even the muscle and the tendon will become less firm, less tense. So that's the TMJ massage. You can also massage the muscles along the head, just like if we get a tension headache, all of that tissue is really tight, and a massage makes us feel better, so does it them. So the frontal and the capitis muscles, all those muscles that are along the head, you can massage those just like we talked about earlier in our massage section. You're going to do circles, then you can do kneading, and then linear strokes of that tissue. And you can certainly do them simultaneous. So like I can put her head on my leg and we can do both sides at the same time. Or you can do one side and then do the other. So doing massage all along the head and into the neck. Tension in the neck will also cause problems in the skull and the head. And there's no reason to believe that they can't have tension and have a headache just like we do. So massage in all those areas. There's also a trigger release point that's found at the second cervical vertebra. The first vertebra off the skull is called the atlas, and the second one is the axis. The atlas actually has wings, and you can feel those come out. So if you come right behind the skull and you'll feel some flares, that is the wings of the atlas. You're going to go just behind there, and that's that second cervical vertebra. It's the axis. You're going to put a little bit of pressure just above the bone along the muscle groups. So it's kind of a push in and pull up effect. Push in and pull up. Releasing the tension at that second cervical vertebra helps with tension in the neck and the front legs. It also helps with pain that is in that whole zone. So just doing that relaxation point. Again, this is one where you're doing things like this to relieve pressure. It takes usually 2 or 3 minutes of this constant but gentle push in, pull up. And again with this, just like with the TMJ massage, there'll be a point where the body begins to relax and that tension starts to relieve and leave from that tissue area. It will affect the entire front leg. So you do that simultaneous on both sides. Then one other one that's really good, and I have a lot of my clients that do agility and sporting events or any any event where the owner is also involved and you can get nervous, the dog can get nervous because they feed off of you. So this ear massage, there are many, many acupressure points in the ear, and this is a relaxation technique. So what I do is divide the ear up into thirds, and I take the flat of my hand along the back of the ear, and the thumb is on the inside, and I'm going to pull the ears out and just gradually work that thumb all the way to the edge. Then I'll grasp 2/3 of the ear and do the same thing. While you're doing this, you want to be in a very relaxed mental state yourself. You want to just take a big breath, let the air go out. You want to try to blank out any other thoughts. You're trying to help relax you and also relax the dog at the same time. So now I'll take the entire pinna, it's the ear flap, and pull. You like that, don't you, Cheerio? And then you can work your way back. I'm going to do 2/3, 1/3. A dog who's had lots of ear infections, they may find this uncomfortable just because of the reaction of knowing that if you touch your ear, you're going to put some medicine in it. So this is not for every dog. But for those who are comfortable with this, who haven't had a lot of ear problems, you will find it not only relaxing for you, but also relaxing for them too. When you're looking to help a dog that has some cervical problems, or maybe he's had some TMJ, where the occiput, where the head and the neck connect, where you've been working with improving the range of motion, so one of the exercises we can do with that is doing the treat reaches. But on this one, we don't want to bring their body all the way around. We just want to focus on the motion in the head. So we can have them look up, have them look down. They can look to the right and then look to the left. So we're not wanting to encourage them to turn all the way around like we do with the side bend treat reaches. We're just looking to get some motion in the head. And if they've had problems in the neck, they may not be able to move very much at first. So if you just get their nose up like even 1 inch or so above the horizontal plane, maybe down 1 inch or so. You don't have to expect a whole lot when you're just starting out. Just to get the head to move a little bit can make a difference then on how their flexibility and their range of motion is going to continue to be. So just starting out with small moves, it doesn't have to be a lot, just getting them to follow a little bit. And as that starts to change within the joints, then every joint will begin to be able to move better. This is another one of those exercises that you can always start with doing a little bit of warm compress first to, again, soften the muscles and get some circulation into that tissue, which is going to make the stretches a whole lot easier. A neurologic patient can be a special case. We have one here. This is Gus. He's 14 years old now, but when he was 5, he had suffered a disc rupture in his back and had back surgery. When we first met Gus, he was 10 years old and hadn't walked for 5 years. He would get up and take a step or two, but most of the time he just drug himself around. So his owners, once they realized there was something of animal rehab, came and asked us, was there anything we could do for Gus? At that point in time, I wasn't certain that seeing a patient that had been paralyzed for 5 years, if we really could make a difference. But within 3 months of doing therapy with him, he began to walk. And this is 4 years later. Mostly now he doesn't wear the harness. I've put it on him to help with us today in doing our demonstrations, but he gets around well. Sure, he's got a funny little hitch in his back end, but he can move around from the house to the barn, and he really thoroughly enjoys life. He'll even chase the boys when they're playing football some days. So Gus can do a lot, and for 5 years he could not. So don't underestimate the power of healing and the tools that you have in your very hands. When you have a patient or a dog that can't walk and get around, we want to make sure that we are doing things to try to stimulate them. So tactile stimulation, that means doing something that could cause them to tickle or would get a reaction from them. So you would normally do this without the harness on, but what you want to do is find spots on their body, the little ticklish spots, where you can move your hands and do things that would get them to start to bring that rear leg up, like they would be trying to scratch themselves. Yeah, there we go. There's a little ticklish spot. Also, when we have neurologic patients, oftentimes at first they can't even get themselves upright. And a dog, being a quadruped, is designed to stand and to be in that sphinx kind of position. And so you don't want to leave them lying on their side all day. You don't want to just switch from side to side. You actually want to prop them up. So use some pillows and cushions, or put them between the ottoman and the sofa on the floor. You want to get them in safe positions, safe places, and in positions to where they can actually be kind of like a dog really is. The next area of things that we want to do, in addition to those, is actually having the support devices. So we talked earlier about having the harness, and this is the example of the ones that we like to use. Yes, you want to get up? Thank you very much. There's an exercise that we call bouncing. Stand and bounce. So with the harness on, you would have a leash on the harness, and you take them out for a walk. And every little bit, with using the giddy up, which is going to help their rear end so they're not having to walk on their own, you will actually stop along the way with their legs in a squared position. There you go. And you're just going to do a little bit of bouncing. This is helping two things. You're helping them, but it's also helping themselves get their balance, and it's increasing the weight bearing going through those rear feet. You could do this in the front as well, depending on where the problem is. So if you have a body that has a cervical malfunction, you're also going to have some impingement and impairments to the front legs as well. So this is the bounce, the stand and bounce. Take a few steps, get them in a nice square position, and apply a few little lifts, which create, as they go down, the bounce. Passive range of motion exercises are those that you can use immediately post-op, and this is about increasing mobility in the joints. So we want to move the joints in flexions and extensions. It will help with circulation, but these are not the kind of exercises that are going to build muscle tone. So I'm going to show you these type of exercises. They kind of call them like a bicycle motion. Like, so if you're on the bike and you're actually bicycling, it's that kind of motion that you would do with the legs, the front and the rear. It's just a slow, you bring the leg up, out, down, back, up, forward, down, just like you would on a bicycle. That's called passive range of motion. You are gently working those joints, helping to keep them from freezing up. You're reducing stagnation. You are getting the muscles to move, but this would not build muscle tone. You can do the same thing on the front legs, the very same kind of motion. When we want to build more muscle tone in the rear legs, we're going to do what are called toe pinches. Toe pinches involve taking the foot, and a dog has 3 webs, so they have 4 toes, not including the dew claw. We have 4 toes, and then there's a web between each of those toes. So when we have a dog that's paralyzed or has paresis, which means lack of input, but maybe they can still get up to some degree, they also have reduced nerve input to their feet. So they'll tend to drag their toes. They don't place them down. They'll be left up under them. So what we want to do is increase the function and the awareness. So the less function and awareness that they have, when you pinch, they're not going to really pull the leg. So these are gradients of what you can do for a dog that doesn't have any neurologic input to this area. So we pull out the leg and pinch. Now that's the reaction that you want. You're going to do it in each web. And when you do pull, you're going to hold it for a little bit because you want them to really work at bringing it back. Now see, this web is not quite as strong in Gus as that web is. And these are the kind of things that you'll find as you go along. Now that web is also stronger. So when he goes to pull it, I hold it just a little bit because I want to get those muscles working. So I'll pull out the toe. So the web between the toes, I'm going to pinch in that area. I pull the foot out, and then I'm going to wait for him to start to bring it back. There you can see him pulling, and then I'll let him have it. The other thing you want to do is offer them a lot of praise. You want them to know that what they're doing is a good thing. And so this is also going to increase the awareness of what's happening in this foot, which prior to now, they maybe didn't even realize they still had. So you will do each web 3 times, so that's a total of 9 for that session. You can do these toe pinches multiple times throughout the day. And this is something that is going to improve the function of these muscles. To do the opposite leg, you actually have to turn them over. You cannot expect them to be able to navigate this leg, to pull it back when it's on the down side, because they have their body weight on top of it. So in order for us to do his left rear leg, we would need to turn Gus over. But you have the idea here. You have 3 webs. You're going to pinch on that while you pull the leg out. You want them to actually get some action, and then you will release it and praise them for doing a good job. So a total of 3 webs 3 times, that's 9. And you'll do that multiple times throughout each day. A dog that can't walk needs some upright time, and that's where the balls come into play. Depending on the length of the body and the height of the dog, you may use 1 or 2 balls. So for Gus, we actually have 2 balls of different size under his abdomen. This is going to give him the support and more balance for what we're going to ask him to do when his body really doesn't have support or balance. Helping him create some independence. One of the exercises that we want to try to do is to get gravitational forces back through the feet. These feet that are not working, we're developing flexor tendon contraction. The tendons on the back side, because the foot is not being laid down and there's no weight going through there, they are not being challenged. So those tendons early on will start to contract. When that happens, it makes it more and more difficult for the foot to get in a right walking position. So with them balanced, so the quadrants, his legs are pretty even here, and he's up on his balls, I'm actually going to show you some ways that you can help extend these flexor tendons. One way with them standing is just to come to the hock, and you're just going to work. I place the hock in the crevice between my thumb and hand, and I'm just going to push down on his paw. Now this works as long as they don't have arthritic hocks, or if they'd ever had an Achilles injury, this would not be the point of reference that you would want to do this. You'd have to move down the foot somewhere further. But as long as their hocks are good and there isn't anything wrong with the Achilles tendon, you can do pressure. So now I'm doing both feet at the same time. And you can actually alternate. Now see how he's pushing off here, to where you actually get a walking motion in those feet. While he's up on the balls, you can move up the leg further. So up here at the pelvis, the top, I'm actually going to put pressure through the pelvis down through the legs. So now we have more joints involved in this walk. We started off with the hock and the foot, but now when I put pressure up along the top of the pelvis, we are actually going to engage some motion between the hip, the knee, the hock, and the foot. So I'm just gently putting pressure through each side of the pelvis, alternating, giving him some little bounce this way. Now this is a little bit different than the bounce that we did with the giddy-ups on, because that we're pulling him up. This we're giving him that read as if the weight of his body was going through his hips from the pelvis, as opposed to under the pelvis coming up and then feeling the ground when he comes down. Even though Gus has done better over the past 4 years, he would not be able to be as effective at doing this if he didn't have the balls underneath him. So again, alternating the pressure, repositioning their legs as need be, so that we have the foot on the ground. One other exercise you can do, which is very similar to this, and this one you could certainly do with them lying down, is to take the paw and hold his foot and just do compression. So I'm doing little pumps. 1, 2, 3, 4. We usually work up to 20 pumps, and depending on how much flexor tendon contraction you have will determine how far that foot can really move forward. So just like with all the exercises, you want to do enough of these that you're actually getting some stretch, but not so much that you're going to cause them to be sore. We don't want to OD on fun. Alrighty, Gus. So that is the paw pressure compression, just at the paw, through the hock, and across the pelvis. Slinky is an exercise that we use for dogs who have reduced neurological input to the rear legs, and we're wanting to gain flexion and motion and strength. So just like a slinky, if you remember the toy Slinky, you push up on one side and there's a little bit of a lag phase before you push up on the other. That's the feel we're going to have with the rear feet. The other thing that's important is that as you hold the paws, you're actually putting some pressure on the foot itself. So we pick up the leg, and I'm holding the metatarsals and I'm pushing up on the toes. So I've got 2 fingers down on the paw and then holding the metatarsal. And this way we can increase that flexion extension, the flexor tendon extension in the leg. So we're going to do this on both paws, grasping at the metatarsal and pushing up on the feet. And then I'll start the slinky motion. So start with just a little bit. It's kind of like a stair stepper thing too. Now for a dog that's paralyzed, they'll have no motion here whatsoever. They won't have any resistance against you. You'll just be strictly doing that up and down. And then as they get a little bit stronger, they will start to begin to resist. And that's a good point. That's when you know you're starting to make some progress, when they are actually starting to resist you doing the exercise. So they'll get to where they'll really push into your hand. So you'll do that exercise back and forth. You can do it up to 20 times. If you want to do it in sessions and sections, you can do 3 or 4 and then let them rest. Then maybe do 4 or 5 and let them rest. And you can work up to your 20 times in a row. But you're working at getting that feeling of a slinky. And we have owners do this all the time on the dogs that don't feel their feet and are having troubles getting around, obviously, is this slinky, or nowadays, as some people will call it, a stair stepper. When you do it too, the idea is to get the motion from the legs. So you want the movement from the foot to the hip is where the most of the motion is. It's not about, we don't want to have a lot of this, the pelvis going up and down. The motion is supposed to be between the foot to the hip. And obviously Sarah doesn't have any problems walking and getting around. But when you have one that does. So the idea is keeping that top line flat while you're working those feet. And that will help them begin to feel like it would be if they were on the ground, and they'll get to a point where they start pushing against your hands. And that's when we really start making some more gains on those dogs who have neurologic problems.